Hello everybody, my name is Dr. Craig Fichandler with Advanced ENT Allergy. Each week we take your questions and answer them. On this episode I would like to talk about bloody noses, tinnitus, and children who experience vertigo.
All winter my mucus has been thick and bloody. My nose is crusted in the morning, and when I blow my nose there's always blood. What could this be?
So this is a question we get a lot, especially in the winter months. What tends to happen to people is we're indoors more, the heat is on, that tends to dry out our nasal passages and the mucus in it gets thicker. In addition, when you dry out the nasal passages, that makes the blood vessels right underneath the surface much more susceptible to bleeding. So what ends up happening is you're sleeping in the dry air all night. You wake up in the morning, you blow your nose, it's thick, it's bloody, very, very common. Usually what the easy treatment for that is adequate hydration, meaning making sure you're drinking enough water. If you're on antihistamines but don't need to be, that can certainly dry things out. If you're a smoker, you're definitely going to be more prone to that. If you're on blood thinners or aspirin or ibuprofen, that can make you bleed more. But also, putting a humidifier in your room can be very helpful in eliminating that dryness and thin out the secretions a little bit. Some people will use nasal saline or ointments in the nose, and all of those help. There are certainly medical conditions and medicines that can make you more prone to this, but just generally keeping things humid and moist in the nose will kind of go a long way to prevent things from getting real thick and getting very bloody secretions. But again, very common in the winter. So if that does not help, I suggest going to see a medical professional about that.
What is the cause of constant tinnitus in one ear that has persisted for 2 years?
That's a tough question because without actually talking to a person or doing a physical examination, I can't really tell you what the actual cause is. I'll give you a few disclaimers. First of all, a lot of the times we never really identify what the cause of tinnitus is. Secondly, if you haven't seen anybody for persistent tinnitus, particularly in one ear after 6 months, I definitely recommend coming in to be evaluated, particularly by an ENT and an audiologist. We have a very good audiology staff here, and we value their opinions on things. It's not just a hearing test. So they can make some good recommendations. Ringing in the ears most commonly is caused by several things. Loud noise exposure. It tends to happen as we age. A lot of people have tinnitus in both ears but hearing loss in one ear, and that can make it seem like the ringing is louder in the other ear. But there are several other medical conditions that can cause it. Otosclerosis is one of them. There can be some intracranial or brain or nerve issues that can do it. Things like diabetes, which is very common. Medications can cause ringing. Now, when it's medical or medicine-induced, that tends to be on both sides, but up to 20% of tinnitus can be on one side. So it doesn't mean that something's bad or you need an MRI, but getting an evaluation would be very helpful. Other things such as stress, vascular disease, carotid artery disease can cause ringing. Even other psychiatric issues can be a cause. So having a full evaluation is a really good idea, again, especially if it's been more than 6 months. So I certainly recommend getting that checked out.
Can children experience vertigo?
The short answer to that is yes, children can experience vertigo. The more interesting question is, what are they actually experiencing and why? A vertigo, by definition, is a sense of movement. Usually it's a linear movement, usually a rotational or spinning sensation. It's more common in adults, but children can experience that. And they have to be evaluated for multiple things. Have they had any trauma to their head or their ears? Do they have any visual issues? Are they having any hearing issues? Are they on any medications that could cause this? The most common reason that we probably see vertigo, which is still pretty rare in children, is an ear infection. So having us evaluate them and having an audiologic evaluation or a hearing test done is very helpful in that situation. Interestingly, vertigo in children is actually linked to migraines later on in life, so that's something that would need to be monitored if they do truly have vertigo. But yes, if you're suspicious about vertigo or even dizziness, I would say bring them in for us to evaluate them